We're back. Now we're getting ready to go over. I've got my supplies together. Now we're getting ready to implement my skill. I always teach my students that before you perform the skill, make sure you have all your supplies. What are the supplies that we need for assisting a resident with bedpan, measuring urine, and hand washing? So let's make sure we got all our supplies before we start. So we have our bedpan, we have our Chucks pad or wash barrier, waterproof pad that you can use under the bed. We have a bath blanket to cover her up so she's not exposed. I have my gloves. I have my wipes. I have her tissue, and she has hand sanitizer. So we're now getting ready to go back, and we're going to already assume that we given her privacy. So now we're getting ready to start implementing our skills. So we're going to go over to the patient. I have all my supplies. I've already did everything. So now we're getting ready to start our skill. Okay, Miss Jones, I'm going to start taking down your cover. We're going to get ready to get you together for your skill. So I'm going to put on my gloves. I'm going to take down her cover just slightly because I'm going to put on her bath blanket to keep her covered up so that she's not exposed at any given time. So I'm going to pull this down just a little further, and then I'm going to get my bath blanket, which can be a towel or warming blanket. It does not matter, but you want to make sure that she's covered and protected at all times so that she's not exposed. So I'm going to put this over her. And I'm going to put down my Chucks pad. Okay, Miss Jones, I'm going to lift you up on the count of 3. Can you lift up your bottom so that I can get your Chucks pad up under you? Thank you. 1, 2, 3. So I'm going to put down my Chucks pad. Make sure it's up under her. So now she has a Chucks pad on the bed, and now I can apply my bedpan. I'm going to put the bedpan now on there. They want this part to be on her hip area. So you want to make sure that this is facing her feet. This is a standard bedpan, and they may give you, depending on what the test proctor wants or what they have available, she may say a standard bedpan, or she may say fractured bedpan. So whatever bedpan that they ask you for, please make sure that you pay attention to what the scenario is asking, because they're going to give you a specific pan to use. So I'm just going to assume that they told me the standard bedpan. So the standard bedpan this goes against the hips. So you want to make sure that it's on her hips. So I'm going to ask Miss Jones to lift up. Miss Jones, can you lift your bottom? Because on a scenario, it's going to say that the person can assist you, give you some help. So I'm going to lift her hips. 1, 2, 3. And I want to make sure that she is on her bedpan, covered up. Okay? So now I'm going to let the bed up. So that she's nice and comfortable. You comfortable, Miss Jones? That's far enough? Okay, she says that's far enough. I'm going to give her supplies. Okay, Miss Jones, here's all your supplies. Here's your hand sanitizer, your wipes, your call light if you need it. And I'm going to close your privacy curtain. Her privacy curtain is closed. For privacy, when you're finished, just turn on your call light and I'll come back in. So now that Miss Allen is on the bedpan, she's taking care of her business. Now she called on the call light for me to come back in. So now that I'm coming back into the patient's room, I'm going to take Miss Allen off of Miss Jones off of the bedpan. So I'm going to just open up I'm going to come in. because the door is already closed. I'm going to move my supplies out of the way. Okay, Miss Jones, I'm going to take you off of the bedpan. Is that okay? I'm going to let the head of your bed down and just make this process a little easier. So we're going to let the head of the bed down. So we're letting her head back down so that she doesn't, it's easier to take her off. There's no pressure there. So now that her head is down, I'm going to take Miss Jones and lift her up. So for me, I'm going to be taking the bedpan and her Chuck's pad at the same time. So at the count of 3, I'm going to take you off your Chuck's pad and your bedpan. 1, 2, 3. So I'm going to pull this from up under her. I'm going to have this in my hand. I'm going to discard the content into the graduate cup that you have. Your graduate cup is here. And now you're going to have urine in it. So now I'm going to discard of this. So what are we going to do with this? So now I've already got my urine put away. She's still covered up. Now I can go, I'm going to put this down. And I'm going to take the cover, me, the way I like to do it, because I still have on my gloves and I've touched the urine that may be potentially in there on the bedpan. I'm going to take the top part of the warming blanket and I'm going to pull that down and I'm going to grab her cover. And as I come up, I'm going to take that part out so that I can discard that. So I'm touching her only with the cover that is here. Okay? So now her call light is here. I'm going to leave her covered up in the bed. I'm going to discard my towel into the dirty linen. I've discarded my towel into the dirty linen. I'm going to get rid of my Chuck's pad into the trash. So I'm going to put this in a trash can. Trash can is right next to me. I'm going to put this in the trash. Now I'm going to go discard, I'm going to go rinse out the bedpan. So I'm going to grab me a paper towel. I'm going to talk you through it because I didn't turn it towards the sink, so you can't see at the sink, so I'm going to just turn it on. I'm not using any water, but I'm going to walk you through every part of the skill. I'm grabbing my paper towel. I turned on the water. I'm rinsing out my bedpan 3 times. Once, rinse it again. Twice, rinse it again. 3 times. I've rinsed it 3 times. I'm going to sit it on the counter. I'm going to grab my paper towel. And I'm going to hold it because I've rinsed it. Now I'm going to grab my paper towel, clean out the inside because I've already washed it out. Clean down the inside. Discard that one. Get another paper towel. Clean out the outside. Throw that one away. Grab another one to go put my supplies away into the patient's drawer or the designated area for this bedpan. So it may vary depending on where you're the test observer in the site. They may ask you to put it in the patient's drawer, or they may ask you to put it back on the shelf that will be perceived as the patient's bathroom or designated area for you to put the bedpan in. Now, once I've done that, now I have to measure the urine. So it's on my barrier. So I would be measuring my urine. At that time, my proctor, you're going to look at your urine. So let me pull this a little bit towards you because it's on my barrier. And you want to look at this at eye level. So I'm going to pull this back up and I'm going to measure my urine at eye level. So now I know I have 2, it's going to say they want it in mLs. So I'm going to measure my 200 mLs of urine. And now I'm going to pour this into the toilet. So I'm going to pour that out into the toilet and do the same process that I did with the bedpan. I'm going to rinse out my graduate cup 3 times. Rinsed it out once, rinsed it out twice, rinsed it out 3 times. So once I rinsed it out the 3 times, I'm going to grab my paper towel to hold it. Then I'm going to grab another paper towel to clean the inside out, dry the inside out. Discard that one, grab another paper towel, Dry the outside out. Discard that one, grab another one to put it in the designated area, which may be the patient's nightstand. So wherever you're supposed to put your supplies based on your testing site and observer where she wants you to put your supplies, you will put them back, but you should have a paper towel with gloves on in both hands, one holding this and one to discard to open up whatever you're doing, because again, these gloves had urine on them, so you don't want to be touching anything. So I would be grabbing and putting away my paper towel. So one thing I didn't do, usually when I put my stuff away, I put everything away when I clean it that way. I usually put all my supplies away once I get my, once I cleaned out the bedpan. I would normally put everything inside that bedpan and take it with me, but I got paper towels so I can put my supplies away. So either way is fine, but you should always have something in your hand as a barrier between you and the supplies that you're putting away, because those gloves are saturated. So once I'm finished, I'm going to discard my paper towel. That's thrown in the garbage. Now I'm going to discard of my barrier. So my barrier is going in the laundry basket. So I'm going to take my barrier and discard that into the dirty linen. So I'm going to throw that in the dirty linen. And now I can remove my gloves. Now this is one of the things that I see students do when they come to me. They always removing their gloves incorrectly. I see them moving up under here. I tell you guys, you want to remove, you want to pinch your glove in the middle, pull it off, ball that one up in your hand, go up under the glove, and the glove should turn inside out, and you discard it into the trash. Now my hands are clean up under my glove. So at this particular time, I can now go assist Miss Jones and make sure that everything is what it's supposed to be. So I'm going to give her her bedside table. Okay, Miss Jones, here's your bedside table. I'm going to open up her privacy curtain. I'm going to adjust her, make sure everything is the way it's supposed to look. Give her her call light back. Miss Jones, do you need anything else? Miss Jones says she doesn't need anything else. I'm going to let her bedside table down, put all her belongings back on here, make sure I sanitized it and everything. Then I'm going to come back, look at my environment, make sure everything looks appropriate to me. Then I'm going to go through my skills. Before I tell my proctor skill complete, I'm going to walk myself through each step of that skill. Did I knock on the door? Did I announce myself? Did I let the patient know what I was doing? Did I provide her privacy? Did I check the bed for safety, lift it up and down to the appropriate height for safety purposes? Yes, I did. Did I use hand hygiene? Yes, I did. Now, at the end of the skill, I am to wash my hands. So we will go through the process of washing our hands. I'm just going to turn this a little bit over there to the sink. Now this is my sink, and we're going to go over, but I'm going to show you how you properly wash your hands, but I'm not using any water. I typically don't, because your hands dry out, and we're just practicing, and we're not using it on a live person. But if you're on a live person, which you won't be doing any kind of pericare on a live person unless you're in a clinical setting, you can just, we're going to make shift like we're washing our hands. So I'm going to grab my paper towel. I'm going to turn on my water. I'm going to discard that into there. We're going to pretend I discarded that. We're going to wet our hands. We're going to apply soap. You're going to wash your hands for 20 to 30 seconds, getting all the way up to your wrists, your fingers, applying friction, singing happy birthday to yourself, ABCs or Mississippis, whatever you were taught. It is fine, but long as you're washing your hands for 20 to 30 seconds, that is the goal. Making sure you're getting up under your fingernails. Once you've done all of that, you can rinse all of the agent off of your hand. Once you rinse all the agent off, we're not flicking our fingers. We're putting our hands straight down. We're going to grab our another paper towel and we're going to dry our hands. You're going to take another paper towel and dry your hands again. You're going to grab another paper towel, turn off your water, discard that. Then after you've done all of that, remember the skill was we measured urine. So after we washed our hands, we have to go record that particular urine that we put down. So on the top of that sheet, it's going to have your name. At the bottom, you're going to sign it. And it's going to be a section where you have to put how much urine that was in that particular graduate cup. So you should have made a mental note to remember how much was in that graduate cup. Because once you've completed your skill, you're now going to go record how much urine was in that particular graduate cup. And then the test observer, he or she, is going to look and measure again along with you to make sure, and you have to come within 25 mLs of your particular test observer or proctor. So you want to make sure that you put a mental note of how much urine at eye level. So once you've done that, you will go finish and document your skill. Then you would tell your proctor, my skill is complete. So please like, subscribe, and share. I will be bringing videos to you, and I promise I'm going to get better. This is just my initial videos, but I will be getting better and better as we go. But these are how you do these skills to be successful in the state of Michigan, and it may be applicable in your state if this is one of your state testing skills. Keep looking out for new videos. I will be posting them every week. And I will be updating them and making them a little more professional as time goes on. But please bear with me. We're going to get there, and look out for those videos. Take care.